Your Excellency, the President of the Republic of Rwanda, President Paul Kagame, Your Excellency, the President of Mozambique, President Filipe Nyusi, Her Excellency, the First Lady of Rwanda, Mrs. Janet Kagame, and all other First Ladies present, Excellencies, distinguished guests, colleagues, ladies and gentlemen. I warmly welcome all of you on behalf of the Board of the Society for AIDS in Africa, the co-organizers of this important conference, to the 20th ICASA, holding in the beautiful city of Kigali. Let me start by first expressing our sincere gratitude on behalf of the Board of the Society for AIDS in Africa to His Excellency President Kagame and his government for their support, without which this conference would not have taken place. We are grateful to Kigali, the Rwandese people, for their very warm welcome and hospitality. Let me also take this opportunity to congratulate Winnie Byanyima, the new UNA's Executive Director, and to reiterate, the Society for AIDS in Africa looks forward to you to provide the much needed leadership as we continue the journey to end AIDS by 2030. According to the UNAIDS 2019 report, we have continued to make gains and progress in the last 4 decades in the fight against this epidemic. But these gains are getting smaller from year to year. We have witnessed a steady progress in the reduction of AIDS-related deaths, but efforts to reach the 2020 targets for reduction in HIV infections are clearly off track. Therefore, the HIV pandemic is likely to remain a major global challenge for the foreseeable future. Millions of people will require sustained access to antiretroviral therapy. More efforts will be required to prevent resurgence of HIV among the large and ever-increasing population of young people, especially in Africa, and the need to intensify efforts to address the high prevalence among key population in many of our countries. This year's conference in Kigali is held under the theme AIDS-Free Africa through innovation, community, and political leadership. This theme brings into sharp focus our commitment as a continent, and with support from our bilateral and multilateral partners, the need to be innovative and inclusive if we are to end AIDS by holding ourselves to account to achieve our set targets. The theme also builds up from Africa's efforts and aspirations of the past 4 decades in the fight against HIV, and is meant to renew the continent's commitment by drawing attention to the fact that the legacy of ending AIDS by 2030 is now under threat as a result of the widening gap between resource needs and resource availability due to significant declines at global and national levels. We therefore urge all our partners to step up action to invest in the response, and we call on our governments to seek domestic solutions for a more sustainable response on the continent. Communities remain the epicenter of Africa's response. This is reinforced by this year's World AIDS Day theme. Communities make a difference. It is imperative, therefore, that we continue to focus on community systems strengthening for health to achieve efficiency and accountability of the health system, as well as realizing constitutional rights of citizens' health through adequate resource allocation. I've learned a lot of lessons from the multi-sectoral, multi-stakeholder AIDS response, including engagement of civil societies, which are key to progress across sustainable development goals and achieving universal health coverage. We've seen an extraordinary knowledge, skills, and expertise that have been built, new ways of implementation, and embedding evidence-based practice. Its response, therefore, has garnered substantial experience for integration into other infectious diseases and sexual and reproductive health, and also addressing entrenched social norms, social exclusion, and legal barriers that undermine health and development outcomes. The threat posed by non-communicable diseases and emerging infections cannot be overemphasized. And this conference remains alive to the need to continuously create space for candid discussions around these diseases, as well as utilizing the over 3 decades of experience gained in fighting HIV to craft strategies to respond to these new threats. Let me thank, in my concluding remarks, the partners and sponsors of this conference who have always supported ICASA through the years. Our thanks also go to all our dear delegates, for without you there is no conference. We must express special appreciation to the Board of the Society for AIDS in Africa, the Ministry of Health of Rwanda, the Rwandan Convention Bureau, who worked tirelessly to ensure that we host this conference with a success. We also thank the international steering committees that did all the planning initially for this conference. We thank also the ICASA conference director and the secretariat. We thank the media and all those of you who directly or indirectly have contributed to the successful organization of the 20th ICASA. Thank you very much.